Hi, I'm Sarah Bruce and welcome to EHI TV, eHealth Insider's essential news on video. This week we've got a live link up with our editor John Hoeksma from the world's biggest health IT conference in Orlando. But first, let's get the top 3 most read news stories back here. Our third most read news story this week is still the news that the Department of Health is considering terminating its contract with the National Programme for IT supplier, CSC. The news follows CSC's failure to implement electronic patient record Lorenzo on time to 4 key early adopter sites. The story has topped our charts for 2 weeks now, with readers desperate to know what will happen next. At number 2 this week, and despite things looking bad for CSC on the acute side, rumour has it that the company has won the ASCC procurement for providing child and community health systems to 17 trusts in the South by bidding TPP Community System. Perhaps the award of this contract might make any scaling back of any other contract slightly sweeter. And at number 1 this week is the news that the DH is working on a plan to keep informatics services working during the latest round of NHS reforms. A new letter from David Nicholson on making the transition recognises that the health bill and even the information revolution consultation has so far been unclear about how NP-fit services currently delivered by SHAs and PCTs will be maintained. It adds that SHAs and PCTs have been asked to detail their current IT systems and informatics capabilities in order for a transition plan to be finalised by the end of March. The letter also says that a working hypothesis for the future state of informatics has been developed and is being tested with major stakeholders. Well, they're the latest stories here in the UK. Now let's go direct to John from this year's HIMSS.
This is John Hoeksma speaking from the Orange County Convention Centre in Orlando. I'm here at the HIMSS 2011 Health IT Show, where over 30,000 delegates have gathered to find out how IM&T can help modernise the US healthcare industry. Over 1,000 exhibitors are showing their wares, with 200 electronic health record vendors alone. And if last year was the year where meaningful use dominated thinking, with people trying to work out how to get their hands on a slice of the $20 billion of investment in electronic health records, this year there's been new themes added, particular renewed focus on measuring quality and outcomes of healthcare, and how to interoperate, to share data, and connect together America's fragmented and hugely expensive healthcare system. There's a palpable sense of excitement here that IM&T has an absolutely crucial role to play in modernizing US healthcare. New themes which are running particularly strong with the show this year include mobility, where apps after app is on demonstration. You can barely turn from one stand to another without being offered the chance of winning an iPad. And it's reflective of just how much innovation is on show. Many of these companies may eventually crash and burn, but some of them will certainly win through. But more than anything, it's this sense of what can be achieved, that the role that technology has to play in modernizing healthcare is absolutely critical. It'll be interesting to see whether some of the developments over here begin to play their way back into the UK's NHS. We'll have to find out next year. This is John Hoeksma reporting from Orlando.
That's all we've got time for this week, so I'll see you next.